Hey guys, it's Lynn, and it is day 5, I believe, of my 22 push-up challenge 2.0. Hey everybody, this is going to be a little bit of a quicker video because, as you guys can probably see, I'm in a different space right now. I'm actually at work. I'm on a work evening and had a very busy early day, so my apologies for getting this video up late and for being a little shorter than normal. I wanted to, sorry, I'm trying to make sure you can see me. I wanted to just talk a little bit today again about MST, and I thought I was going to wrap up MST today, but there are a few more things I think we need to talk about. Now, I thought I would just talk briefly today about what to do if you have been sexually assaulted rectally. Because I do know that this is an issue that happens in the military and elsewhere, and it largely does go unreported for many reasons, some of which we've talked about already. And given that people tend not to report this type of trauma, I think it's really important for them to understand just a few little things that might help. If you have been assaulted rectally, you are probably going to have bleeding and tearing, to say the very least. And so a little bit of clean, preferably sterile gauze from a package on the area to contain the bleeding for, you probably need to sort of apply that gauze and apply a little pressure, even if you can hold it there or sit. For about 5 minutes, and that should help the bleeding stop, definitely, for about 5 minutes, okay? Then you would gently remove the gauze, and you would wash with warm water very, very gently. This is, again, if you are not reporting your assault. If you are reporting your assault, you go to a medical professional, whether it's emergency or your physician, ASAP, and you don't do anything but placing gauze in place to stop the blood if you are reporting, because they will need to do a proper examination. Okay? So if you are not reporting, after you've had gauze in place of your rectum to just on the outside, with a bit of pressure if you can tolerate it to stop the bleeding, you would wash very gently with warm water, and you would pat dry with a small towel or even a dry face cloth. Make sure the face cloths and towels that you use are clean and are only used for what you are using them for. You don't want to transfer any potential germs to areas that are torn or bleeding. So after you wash gently with warm water and pat dry, I would advise anyone to do as little physical movement as they need to until the pain subsides and until they feel like they can walk comfortably without potentially hurting themselves. Now, if you have bleeding that does not stop, or if you are finding you're not able to move your bowels, or if things don't feel right, this is something you need to see a medical professional about. That is an emergent, potentially emergent situation. So the sooner you get that seen to, the better. If you go see someone and you're still not comfortable talking about why you are seeing this professional for rectal trauma, you can just tell them that it's not something you want to talk about. That's your right to not have to disclose that. But I would encourage you to disclose so you can be properly treated and perhaps connected up with resources that are supportive and that will help you get through this. If you feel comfortable and safe with the person you are talking to, okay? And if you feel they're treating you with respect. Often, folks, nurses are good people to talk to about things that happen to you that you think nobody would understand. I've been a nurse since 1986, and we nurses see a lot of things that most people couldn't even imagine. And so we're used to that. And most nurses I've met over the years are non-judgmental, or if they do have their own feelings, they tend to keep them in, and they're very professional with patients. So if you're looking for someone, you have to talk to somebody because you need to get medical assistance for rectal trauma. Gauge, certainly have yourself seen, and gauge how you feel about perhaps the nurse that is caring for you. That may be a helpful starting point. For people who have rectal trauma that do not require medical intervention, after your initial care and initial rest, a sitz bath, which is a couple tablespoons of Epsom salt in fairly warm water for about 15 minutes, a couple times a day. That will not make things perfect, but it will help with comfort. It will help reduce swelling, and it will help in the prevention of infection. So for a sitz bath, some people use a tub. I don't like that because people stand in tubs a lot to take a shower. So I advise people to purchase a little, you can get an actual sitz bath for roughly $15 to $20 at the drugstore. Tell somebody it's for your mother, you know, if you're embarrassed picking it up. It's basically, it's a little basin with holes in the back that sits on the ceramic portion of the toilet. And you would put warm, very warm water, not hot, but warm, using a clean pitcher or glass or whatever to fill that, and a couple of tablespoons of Epsom salt. And you soak your bottom for about 15 minutes. And then again, you may want to rinse with just warm water and pat dry. That will help with comfort, the prevention of infection, and with swelling. And all of those things are going to help you with maintaining a more regular or closer to regular bowel routine. When you've had rectal trauma, sometimes constipation goes with that. Your body actually will withhold stool because because your body knows it will cause more discomfort and potential harm if it forces stool through. So, another piece of advice, especially if you are not seeking treatment from a medical professional, would be to purchase a stool softener. They are usually run about $20 over the counter. One of the more common stool softeners that I've seen used for the past 30 years is docusate sodium, or Colace. Certainly if you choose to purchase a stool softener, which would not be a bad idea, because constipation that is left untreated will run you into other major problems. Before you just purchase something, speak to a pharmacist that knows you. And if they're asking you why you need your stool softener, you can just tell them that you haven't had a bowel movement in a few days and you feel like you can't move things. And if they require a bit of an answer to that, that's what I would tell them. But certainly this will help post-rectal trauma. This will help you feel better. Two things that you should seek, even if you don't have enough rectal trauma to actually need medical intervention, and some people do. But if you don't, a follow-up with a trusted physician to talk about blood work, and certainly if you're having signs and symptoms of an infection, that will need to be treated, most likely with antibiotics. So in that instance, you may need to talk to your physician about what happened to you, even if you don't disclose all of the details, and even if you just say it's something that you don't want to talk about. But you're having, say, fever, chills, and maybe some rectal discharge that does not look like stool, that looks like it could be what we would call exudate, which is the drainage that comes out of a wound or infection. Sometimes people will have tears that are slightly internal, and those tears need to be treated with for comfort and for potential infection with very simple to use suppositories such as procticidal. which also comes with a cream that soothes. Proctocidal, unlike docusate sodium or Colace, the stool softener, proctocidal is a treatment and it requires a physician's script, just FYI. Yes, and one last thing before I do my push-ups, blood work. Anyone who is sexually assaulted, whether it is rectally, vaginally, or orally even, I would suggest, because of the potential risk of STIs, sexually transmitted infections, I would suggest speaking to a trusted health professional about some potential blood work. I definitely think that's something that anyone who has been assaulted in any way should do. Now, if you're not comfortable speaking to a trusted physician, or if you don't feel like you have a trusted physician, a really good piece of information for most people, or for anybody, is that most cities have anonymous STI clinics. Some of them are called anonymous STD clinics. At least up in Canada here, we've got a lot of those. So you can go in, you are interviewed, and again, what you disclose, the more truthful you are, the more helpful it is. But the amount and detail that you disclose is up to you. Physical exams are provided, as well as blood work. And here in Canada, for example, I'm from Halifax. There's an anonymous STI clinic in our hospital, and from start to finish, it is completely anonymous. They don't take your name. They give you a number. They test you for everything. They talk to you about your history, and they don't judge you. Or at least here, I find them very, very good, and I would expect although there's always the outlier, I would expect a health professional to be just that, professional. So if you're not comfortable speaking to someone on base, if you're not comfortable speaking to your regular family doctor off base, you may just check the yellow pages or the 411, Google it, anonymous STI or STD clinics. And you can usually find the help you need there, at least for the physical piece of sexual assault. Okay, I am going to do my best to do my push-ups all in a row today. Let's see, I've had half a work shift that's been crazy, but I'll give it a good go, and let's see what happens. Okay, here we go. Okay, whew. I think that was 22. I will double check, but probably not until the end of my work shift. I need to see clients, so I'm going to post my video. And I want you to know, I found at least one article that is more kind of oriented for a medical professional, but it was from Nursing Times, and it's about care post-rectal trauma. And it is a very wide-ranging article. It talks about rectal trauma that comes from certain erotic activities. It also talks about rectal trauma from assault and other medical issues. So rectal trauma, regardless of why it happened, is something that really needs to be properly taken care of. And the article, I haven't posted it yet, but I will post it when I get home from work. The article that I found is definitely worth reading. It gives a lot of information. You may want to skip over some, but it makes clear what the dangers are with various types of rectal trauma and how to follow up if you have been traumatized rectally through MST or for any other means. Anyhow, yeah, so I will put that up after my shift tonight, and I would, maybe encourage people just to save it in case they maybe need that information at some point down the road. And certainly, if you've been a victim of MST, have a look at the article. It will be worth your while. Okay, thanks so much, guys. Thanks for listening. Thanks for all the support. Big shout out to Tony Bates. He's my my buddy here who's agreed to do the push-up challenge. So he's tonight's nominee. And yeah, I'll be back tomorrow. And I think tomorrow I'll talk a little bit more about MST and maybe move a bit about talk a bit about vaginal care post MST, and see if I can provide you guys with some helpful info. Thanks a lot. Take care. Talk to you tomorrow.